So it is good to know that you already knew who is our targeted audience, who is our client. Can you explain me what is the difference between customer and client? What is the difference between customer and client?
Sir, customer will come and buy something from us, but clients, so we have to convince them and like make them sure that yes, we have the best product.
Thanks for the definition. But tell me, who is coming only once, not necessarily again and again, and who is coming again and again?
Customer will often come again and again.
Yeah, once if they are coming, they are your customer. They may be coming, they may go once buy something from you, but client means they will come again and again. So maintaining the clientele is the business, is any business. And tell me why USA is growing faster, their dollar controls all other countries' economy. And take for example, even China is not controlling the economy, despite the population, despite the workforce they have. Why? Just one-liner answer. Why USA number one and why their dollar is controlling other economies? You can compare with India, Russia, China also for that matter. Why they could not? What is the reason?
Petrodollars.
Pardon?
Petrodollars.
Petrodollar.
Yes.
Petrol means USA is not having petrol.
No. What I'm trying to say is anybody who needs to buy petrol today, any form of gas, petrol, diesel, or anything, first has to convert their currency into US dollars, which is recognized by the entire world.
That is why I'm asking why that scenario happened with USA.
Sir, I guess this is way back in the day when there was a war somewhere in the Middle East.
You are reasoning out due to the war. Okay.
Yes, and because US gave help to one of these Middle Eastern countries, they decided that in return we want all their oil to be bought and sold using the US dollar worldwide. So that's how the petrodollar came into action.
That's what. See, Dr. Sthiti also saying dollar is widely accepted. My question is still the same. Why USA emerged into that condition? What is the reason behind the USA? The reason is all the people from USA are not ashamed of selling something to others. They are all sellers. They are expertised in selling. I mean, what I mean selling is, tell me the difference between marketing and selling. Can anybody? What is the difference between marketing and selling? Marketing means getting the clients, getting the clientele numbers, contacts, emails, their IDs. That's it. That is marketing. You give Facebook ad, FB ad, Instagram ad, any other source, Google ads. You are getting the sources. You are getting the leads. But that is of no use unless and until you convert them into your clients. How you are going to do it? Through selling. So selling means where marketing ends, selling starts. So you have to remove the hesitation to call someone, speak to them, explain the thing. Definitely they are waiting for your service and they are going to accept your service. The hesitation, the people from USA, they doesn't have, because whatever the scenario, the USA people, they are fond of selling. So we, the Indians, is totally opposite. The reason, I don't know, but we are going to understand this and move ahead. So what we are going to sell? That is the question. Any guess? Who are present here? What we are going to sell? I am not from material company. I am not going to ask you to sell insurance. I am not here to sell some medical equipments. Nothing. what we are going to sell. Just type in the chat box. Dr. Sthiti says knowledge, skills. Skill. We are selling the skill. Okay, I can agree 50% only. But what we are going to sell? License to practice. If we sell that is not a right approach. They have to earn the license. It should not be sold out. So let me explain. We are going to sell post BDS courses. Okay. So we are going to sell their future. I am going to sell you your own future to you. How many of you interested? How many of you first digest this? Can you call someone and say, see, I am going to sell your own future to you. Listen to me carefully. Will they be careful, or they will say, no, I don't want to listen about my future. I know about my future. You need not guide me. That attitude may be there, but you have to overcome that attitude. We are going to sell their own future to them by properly guiding them, explaining the pros and cons. When you are saying only the gain only, if you say, they will think that if you are talking too much of gains only, then they will think because of talking to them, you are gaining something. Because our mentality is, why should someone gain from me? By that, if that mentality arises in their mind, they will least bother about their own gains also. They will think, why should you gain? That is the reason in India, the insurance companies not allowing the agents to give their commission, to give their share, the commission share to the clients. They prohibited that because it's widely seen in our Indian community, regardless of the state, regardless of the language. When you call someone and saying you are going to gain, suddenly they get some spark. We should be careful. Why should I gain? What by gaining what he or she is gaining? Their thought process goes first. So you have to have some reasonable proofs. For example, if you are talking to someone, have the data, have something in your hand as weapon to give them the clear picture, because we cannot verbally talk. They will definitely say okay, then there is a chance they may block you also. Least bother about all this. Once if you enter into this industry of selling, I already told, nothing wrong in selling. If you think it's selling as such, then it will look like wrong. First you have to come out of this disease. So once if you are entering into selling, I am assuring you, you are going to earn maximum in your batch. You are going to earn maximum in your city, because selling is the only source wherein you need not invest anything. So anybody invested here, anybody to get a job here, anybody put money, type yes or no in the chat box. I want to see. ऐसा तो नहीं है कोई अमाउंट पे करके आया हुआ उधर ट्रेनिंग के लिए? Did you pay anything for this training or to join the job? No, because there is no such process. So coming back to the original query today, what we are going to sell? We are going to sell the future for the dentist. And can you sell inside the dentistry or outside the dentistry? Where you are going to give them the future? Type inside or outside in the dentistry. Because if you say inside, I want to know, I want to learn from you. What is there inside? What they are not knowing, you are going to teach. Because we are not a coaching institute or training institute or academy or any such other thing. Because they know everything. They have already learned in their dental school. They have come out, they have completed their BDS or MDS. That's why they are dentists. And again, while I'm calling you dentists, not only dentists, you can go little bit here and there like medicos. We can take it for that matter. Any person who is medically qualified, we can approach, we can talk to them. And when you are talking, you use all our techniques, what we are giving. So first of all, you utter some sentence, some statement to them. You have to immediately send or WhatsApp or show any video clip. Whatever you are saying, they have to believe with the subsidiary material. It may be a PDF document. It may be a video clip. It may be a YouTube link. You have to give them. After talking, you have to give them. Or while talking only, you can send them. So that you have to convert the monologue into dialogue. How many of you agreeing this? We are dealing with interpersonal skill. This skill, if you have, it will be used in your clinic also, your clinical practice also, because after all, the clinical practice is nothing but you are selling from your counter. A patient is coming to you, you are talking some other thing, patient talking some other thing, patient will get away from you. The patient will say, wait a minute, I am going and bringing my ATM card and vanish. Many people had told me, sir, my patients are coming, they are listening. Next day when I call, instead of patient, their husband or wife picking up the call and saying, we will call you back on our own. That is the reason, because the issue is connectivity issue. Yesterday also somebody could not join this Zoom call because of the connectivity issue. Without connectivity, how would you sell? So you have to convert the monologue into dialogue. So how you will understand that you are in a dialogue condition or monologue condition? You should allow the other person to speak out. Listen, listen, listen. That is a starting point. When you say something, definitely they will oppose. Take it from me, whoever opposing your idea, don't be tensed. Don't be frustrated. They are going to buy from you. See, I have referred more than 5 books in selling and giving you the concrete steps how to do it. Because all the US authors, they talk about selling. Because that is their the primary source for their growth as #1 in the world. So coming back to the condition, once you converted the selling into a dialogue, what are all the information you are going to transpire? That is your strength, the information. Today we are living in the information world. If your information is factually incorrect, they will not have credibility on you. Days are gone. Credibility means your stature, your money, your position, your condition in the society, everything gone. Now you have to strike with the fact. If somebody saying you, opposing you, blast the issue with the facts. No, let me send you something. Just have a look and let me call you back after 10 minutes. Please pick up my call. We will discuss further. This is the right way. So what is you are going to say? First of all, you should have the opinion. You should feel the pain of the person listening to you. You cannot consider about your target. You cannot further consider about I have to do this, I have to complete this call, I have to enter into this today's report. These are all secondary. First of all, you think the person listening to you is expecting something. That's why he had picked your call. And he should think about you that you are a messenger for him in a timely help. Now, see this month, May, people from all over India, particularly in North India, they have to pay the school fees for their kids. And by the time they will be little bit thinking that I am not enough earning right now. And those who are all earning also will feel the earning is inadequate. This is human tendency. When you are calling, nobody will say, I am happy, nothing to do, add on, I am happy. Then you also be happy and leave them. They will come if they require. We cannot force sell. First of all, they won't buy. So curiosity, and you have to give them helping hand wholeheartedly, not to complete your target. You have to help them. It's a very shortcut. This is the very, very short approach to start with. So coming back to the factual things, how many of you thinking today dentists are earning? How many dentists are in the country? Type in the chat box. How many total dentists in the country? Type. How many dentists are in the country? Dr. Sariga, you are saying 5 lakh. Others? Just a guesswork only, because I am not knowing whether you refer the Google or not. Dr. Subham says more than 5 lakh. Dr. Jyoti is saying 3.5 to 5, more than a lakh. Dr. Sthiti saying every year 25 dentists coming out. How come it will be more than a lakh? It will be more. 8 lakhs, Manisha. No. Okay. Let me clarify. Dentists in the country are more than 3 lakh already. They are going to touch 4 lakhs soon. 3 to 4 lakhs. 3 to 4 lakhs. So with this workforce, with this number, we are the single largest specialist in Medico. Type yes or no. Can you get my point? We are the single largest Medico in the fraternity. Single largest specialist, I am saying. If you calculate ENT, Opthal, Nephro, Neuro, Gastro, out of all these specialists, dentists are the single largest specialist in the country. Secondly, dentistry only, there is more unemployedness, more unemployment only in dentistry. We are standing in number 1 in that also. So what kind of unemployment we are facing? What kind of unemployment we are facing? There is multiple layers, multiple different types of unemployment. For example, if you say dentists are more than the patients, dentists are more, patients are less, I will not agree. Why? Because we have 142 crore population. How come 3.5 lakh will cater to the needs of all the 1.42 crores? No, sorry, 142 crores of population. It's not true, no. So the reason is, I will tell you a small story. If you go to the villages, in the villages, many farmers sitting under the banyan tree playing cards. So if you ask them, why don't you go to the fields? They will say there are enough people there. There are enough people in the field. So that's why we are taking rest here. So this is called in economics structural unemployment. That means the land dependent ratio is negative, means it's not favorable. So the extra people sitting under the banyan tree, if you are there, what will you advise them? Type in the chat box. Extra people in the banyan tree in the villages, the farmers, they are not going to the fields. They will say, I don't have the land is already filled with the people. So what will you advise to them? So here Dr. Jyoti says they can go and work in the field. You go and help. But you tell me, they are already convinced that their service is not needed. Even if they go, the person in the field, they will oppose. They will say, why you are coming? Because more people going to the small land, when the land dependent ratio is not favorable, then they will reduce their income. Definitely they will reduce their income. Yes, people are now coming to the catching the point. Yes, we will tell them, catch up the next bus, go to the city and find some job. How many of you are agreeing this? They have to be removed from that stagnancy. We have to tell them, don't go to the field, don't sit under a banyan tree, get out from here, catch out the bus, train or flight, go to the city. This is called urbanization. So many people in our country, many politicians saying that we have to concentrate on agriculture. Agriculture growth is only 2%. So we have to tell all people to go for agriculture. Is it right? Type yes or no. Because many politicians are saying urbanization is growing. It is not good. Go back to our villages. How many of you are agreeing this point? Should we go back to villages? Yes or no? because you are no more a normal individual, because you have moved to the next level. Start thinking. No, we should not go to villages, because villages, the resources and the workforce, they are adequate. Only thing is they need technology. We have to relieve as many as farmers from their working lands, because they are already in suffering. You go to USA, they help the farmers, but farmers are more affluent in USA. They are getting more money. Why? Because they imbibe the technology inside the system, and extra people are coming out. They have to come out. And in urbanization, they have to concentrate on learning the new skills. So I can equate this story to the dentistry. Can I call all the dentists and saying, open the clinic, learn endodontics, rotary endodontics, learn orthodontics, learn surgeries, come join our coaching institute, join our institute. Am I spoiling the system or not? Yes or no? I am calling all the dentists, no, in the name of skilling them. I am conducting some certificate courses. Come join 3 days RCT, microscope. This is the trend now. Am I spoiling the system or not? Yes, we are spoiling them. We have to tell them, come out. How many of you agreeing this? Come out. The person is coming to you and asking you, can I open my clinic? Can I see, I have selected this place. I want to start my clinical practice. I have completed my MDS. I have completed my certificate course here and there. So, some Bhishma Pidamaha will be there. I have undergone some training under the so-and-so guy. All this won't help in their future. The person who is going to prize, okay, I will learn this under someone, I will be also becoming like him. That is the least thing going to happen. How many of you agreeing with this? There is no role model in professional skills, because what you say, what you see is professional skill, but what really working is your personality. Whatever you are seeing, oh, the so-and-so person is so skillful, he is handling so many patients. Excuse me, it is not because of his skill or her skill, it is because of the personality he is holding. So where you have to concentrate, interpersonal skill, how to talk to the patient, how to convert the patient, that is more important. Not necessarily the patient will sit with you in the dental chair. So the point number 1 is clear. Your advice to the futuristic dentists, freshers, those who are all not happy with their practice, is you have to tell them, please come out of this Chakravyuh. You have to tell them the precondition of structural unemployment. If you have any doubt, you can Google. All my facts are clear. Structural unemployment is already established concept, and you need not read the definition. Remember the story, banyan tree story. That is structural unemployment. That is what prevailing in dentistry now. So our concepts are very clear. We have to tell the dentist, you have to add on your skills. You have to come out of that scaling, filling, drilling, plucking, the 9 departments. You have to come out. Yes or no in the chat box? Is it clear? Are we guiding or misguiding? Because tomorrow the same dentist will call you and talk to you. The moment you get the call from the person who had taken your advice, you are winning. Because that thing will happen only if you are guiding them properly. So once you touch this futuristic aspect, no dentist will hang your call up. Anybody listening to you, they will be definitely calling back to you, ask your opinion. So this is called opinion creation. It should happen in a dialogue, not in a monologue. And you should be clear about where you are going to guide. And right now, I am asking the list of emerging disciplines. Can anyone help me out? Type in the chat box, so that I will also learn from you. What are all those such disciplines dentists can cling on? They can nothing. Don't worry about whether they possess the skill or not. We will give them the opportunity. Any skill they can learn. Any skill they can learn, because we are not going to tell them you go for jewelry designing, because that will be too much for them. So see, dentists are totally clinic oriented. So there are some fields like clinical psychology, or for that matter, in academics, there are a lot of research areas. There are many academic areas, as Dr. Jyoti says, forensic odontology, all these. There we have to give them the choice. So neutrally, we are going to say to them, like 10 plus emerging disciplines favorable to dentists, wherein dentists can approach. So I myself, this is my opinion. You may be having different opinion. Suddenly, when you introduce some discipline, that should be feeding them from the day two. That should be feeding them. For example, if I give them wonderful technology, wonderful science, wonderful study, after some 2-3 years, if they start earning, already they are coming out of banyan tree. You remember my story. So if you give them further 3-4 years, then by the time they will lose the track. See, many people are saying forensic odontology. Even I am the person who had done first masters in the country in forensic odontology. But why I am not immediately putting that upon the candidates? Yes, Dr. Sarika, stem cells also there. Yes. So I think I will look out whoever joined their old students. Yes, Dr. Ranipriya, can you type all the emerging disciplines in the chat for me fastly?
What says what we have to buy?
All the emerging disciplines.
Emerging disciplines. Okay.
Yeah, type 1, 2, 3. I think you will type around 10, 15. If you anything list out, I can add on. Because we have to be very clear where we are guiding, because we should not misguide. We have to have ample proof. When you are saying take up this emerging discipline, we have to give them the survey in first year how much you are going to earn, second year how much you are going to earn, third year how much you are going to earn. So you have to give them the clear picture. In next 3 years, they will come out of any financial problem. Otherwise, don't advise them. I am not here for any conversion other than this. If you are helping them, definitely after 3 years, they should be totally coming out of all their problems. Problems in the sense I mentioned only financial problem. I am not here giving any spiritual guidance. That also can be given, but not at this stage. First, give them the food. Then they will come for any other gathering. See, whenever you say suffixed with the dentistry, we are not for that, because that is not our job and it is not legal also. I am telling you, whenever we are giving any advice, any upskilling, any cross-skilling, any reskilling, don't expect dentistry or dental in the topic, because that is not our cup of tea. We cannot do without DCA permission. If I say some new technique in endodontics, I am not the person to suggest go and learn in open market, because anything related to dentistry is coming under Dental Council of India. We are nobody to enter into the domain. Whether they are spoiling the system, whether they are helping the system, it's not our business. Because tomorrow, because of these training programs, neither the advisor like you and me, nor the students should face any problem, because DCA will release one notification one day. All the coaching institutes, academies teaching dentistry are not valid at all. Then what will you do? Hundreds of people will call you. Madam, sir, you told to undergo this training. I had got the training. I got the certificate. Today DCA released the notification. So, see, our concept is very clear. We are telling them to come out of the dentistry. Why should again we go on to teach dentistry in a different format? That means we are trying to sell something. That is the only interpretation. We are not going to do that. We are going to do what we are going to do is by factually. I think had we got the list, let me type. Otherwise, see, these are all the disciplines standing very, very attractively, doing very good, and they are earning. I could verify personally that these are all the disciplines we can easily suggest to the dentist. They can easily see. Implant also I am putting here. Why I am putting? You may say implantology means it's dentistry. But tell me which part of dentistry implantology is coming. Type in the chat box. I am putting implantology as emerging discipline purposefully. Why? See, there is one more discipline called laserology. This terminology is not new. See, oral surgery is part of dentistry. That is a separate discussion. If we have time in the near future, we will discuss. But these are all the discipline what I have typed are emerging disciplines. See, clinic management also important because it talks about the financial handling, how to run the clinic, all this. These are all emerging disciplines. So if any disciplines left out, we can add. There is nothing wrong in learning new thing. Why I am adding implantology here? Because implantology is not controlled fully by Dental Council of India. You have to agree with us. Because in MDS, prostho, perio, surgery, all three are fighting. It's a tripartite struggle for the implants. And nobody is giving clarity who should do, either periodontist, either prosthodontist or surgeons. Prosthodontist calling the surgeons something and surgeons calling prosthodontics something. So you can understand this politics. Implantology is totally with the corporate hand. DCA could not control. That is why DCA said any BDS, any general dentist can practice implantology. The problem is when the treatment goes wrong, the patient goes to consumer forum asking for compensation. The $1 million implantologist hiding. The $1 million implantologist shifting the clinic, closing, shutting down. These are all the cases I personally see. They come to consultation with me. The other day I was going to Chennai. There, next to HOD from GDC Chennai came to meet me, saying that there is a case, implant went wrong, patient blackmailing. Why? Because the implantology, there are many techniques. They are saying single sitting, 72 hours, immediate loading, basal, picobasal, different names, conventional, customary, contemporary. They are different names in the market. They're flooding in the market. So skilling is missing. Every person knowing some implant, every person claiming 10,000 implants, 6,000 implants I have placed. If you calculate total number of implants, it is exceeding the population of India. Those many implants. Yes, thanks for Dr. Rani Priya. She is adding that semi-permanent makeup, cosmetology, all this. Very good. So overall, the cosmetic industry, when attached with dentistry, cosmetology is a common terminology. So that is booming now. No doubt. How many of you expect? How many of you are agreeing to this? The cosmetic industry, and we will discuss about the problems and solutions here also, because our theme is this. We cannot beat the bush here and there. We have to strike. Dentists need immediate monetary benefits. They have the skills that has to be encashed. I have dentistry. I read for 5 years. I have come out. Now I cannot sit under banyan tree. I have to go and work. So if somebody asking you, you have to blindly say, there is a new industry picking up, go and catch up. Then only they will ask where to go, how to go. First you corner them some discipline, concrete discipline where they can go. You cannot say all the emerging disciplines. He will be confused. Then he will think, I will first decide and I will come back. Then if he keep thinking, every day he will see some different discipline is important to him. So you have to guide as if you are in trouble. Then only you can guide. So cosmetology, no doubt I can give them first in the emerging discipline. How many of you agreeing? Please, yes. I will see how many of you agreeing. Then only you can fastly pick up the next part of our discussion today. See, you can disagree with my opinion also, but you should be having proof. I am having proof. So everybody have this video clip. It is a YouTube link, cut and paste. After the meeting, you go and watch. There, we have set the ground on behalf of our organization. We have set the ground for the cosmetology industry. And right now I am going to discuss about the problems first. What is the problem in cosmetology? After discussing problem, then we find a solution today. Today in this meeting only, we are going to find the solution, and you are ready. You are ready to market and sell both. Why I am saying market? Because you have to find right client, right lead, then you have to sell. And people here, they can help the others. Facebook ads, Instagram ads, go and blast in the market and get the clients and convert them and get your salary. Get your salary. Nothing is free. Don't do any free work. So what is the problem here? What is the problem? Can anyone come out and speak? Because it is time to speak. Now you listened, no? Now it is time to speak. Anyone can openly come out and say the problem. Sir, you are saying to suggest cosmetology, but now dentists are having these problems. How can we suggest, or how can we give the solution? Just unmute yourself and come out, so that others also will listen. What are the problems? It is called not problems, bottlenecks. See, when we find solution, like you don't sit in the banyan tree, come out, catch the next bus and come to the city, urbanization. When they come there, there are problems. We agree. There are problems in housing. There are problems in transporting. There are problems in basic livelihood itself. Immediately, some person from village, from agriculture background, Dr. Sarika says finances. Yes, that is the problem. But when a dentist is observing the field, what problem they are facing immediately? Finances, in the sense, you mean to say there is huge finance needed to establish a cosmetic practice, or like that?
Firstly is the finance, and secondly is the license also, because
Very good. Yes, license. License
Yes.
is the first problem.
Yeah.
Because without license, if you open up your shop, what is the problem? The next day, जीना मुश्किल कर देंगे. Because see, first of all, licensing is the big issue. Cosmetology has no license. That is the news. Cosmetology practice has no license system, but the market says some license needed. What we need is dermatologists. Yes, the problem, discuss openly. Dermatologists are problem. Yes. No, I want to I don't want to speak here and there like 4 people trying to find out the elephant. We should not speak like that. Strike the problem. Yes, I I support fully Dr. Sthiti. Medical competitors, you have to understand who is your competitor. Medical competitors will try to demoralize you. Why they are demoralizing? Because in the history of cosmetology, they are right now first time seeing dentists are entering. They could not digest. In the history of cosmetic practice, they have seen many dermatologists, plastic surgeons, gynecologists. Yeah, let them look down upon dentistry. No worries. We are there in the market. Already we have come. I myself converted thousands of dentists who are all in struggle, who are all in dilemma to come to the cosmetic industry. Yes, they will ask. Definitely they will demoralize you. Are you a dermatologist? Yes, but there is no license. Take it from me. I am a medical legal expert. I am saying there is no such license. This is very simple thing to understand. There is no such license, but they will tell you where is your license. That I understand. Now everybody now aware of the problem. Now how to give the solution? Now I am introducing. See, when you fight something, you cannot fight with concept, because you have to go to court. To fight some concept, you cannot fight the concept with your enemy because their concept is different and your concept is different. Secondly, when your enemy is coming to your doorstep to demoralize you because of the financial reason, they will not listen to you. There is a proverb, no, you can awake the person who is sleeping, but the pretending to be sleeping person can never be awakened. So we have this biggest weapon with us called cocracy. So what is this? Can anyone give the explanation, full form of cocracy? This is the robust structure, the legal shelter a dentist. Now it is not only for dentist, any person who is in the cosmetic industry get a fellowship or membership and go and practice. If any problem created by anyone, then they can say, by the time everybody will listen. As a member of cocracy, you can say. Individually, if you say, they will say that your dentist is not paying you. That's why you are trying to catch up other industry. So the cocracy is in the relevant legal section in the country. They are for promoting the disciplines called cosmetology, trichology, regenerative and aesthetic sciences. And this is given as a council. Council means what? Define council. Anybody in the meeting now can define what is council? Then you will understand why I am saying this. Council means setting the protocols to the juniors. Can I call this? Because tomorrow, if anything happens, any legal issues, they will ask the council. They will ask the council whether your member had done right thing or wrong thing. So council will decide. No, you cannot decide. You will say, I have done right. Even if you burn to the face with wrong approach of chemical peel, the patient goes to the complaining mode. Then whatever you say, nobody is going to listen because you are accused. You are going to save your own skin. So how come you will be pretending to be, I was about to save the other skin? So that is why the proverb is also beautifully written. You have to save your own skin means you have to hide behind the council only. There is the only one shelter because dental council won't come. See, there is a small difference. Dr. Hiteshi has defined council as a group of persons having authority to giving recognition. Recognition in the sense, see, you are already recognized as a qualified practitioner. Here, the cocracy role is not to recognize you, but being a proof of your upskilling. I am writing. What cocracy is going to do, it is a proof. It is giving you proof you have upskilled because they are calling you, you are unskilled. So there is nobody in the industry to give you the proof that you have upskilled yourself. And how is we are giving the proof? First of all, we are trying to make it free fellowship. Why we are giving it free? Because when we give freely something, it is meritorious. It is not a scam. It is not getting money and giving. So here only many people are failing. How they are failing? They collect, teach, they certify. The same person teaching cannot certify. That is the thumb rule. When you are touching a field, emerging field, there is no proper licensing available in the country. You have to approach it little bit with common sense. You are teaching some how to give Botox injection, how to give fillers, and you yourself certifying means how it is possible. You took money and certifying. So council system is mandatory. Now, many institutes in the country least bother about all this and landing the people in the trouble. And many people got in the trouble. So I am not saying, I am not highlighting the troubles. They can't do anything. We are there. But you will be demoralized. The person who is listening to you will be panic. Why should I get into trouble? It is better I will go with scaling filling only. So we have that responsibility. We are telling them, look, this is the right way. What is the right way? Now, fortunately, we have our upcoming national event. It is called International Conference on Emerging Disciplines. Can you type the name of the event in the chat box? Where we started, where we are landing now. You carefully observe. Because we are one by one, we are eliminating, and towards solution we are giving. Yes, Dr. Priya rightly said, it's ICED-a-thon. ICED means International Conference on Emerging Discipline. A-thon means continuing education. We call it CME program, but here internationally we call it A-thon, means continuous process, continuous learning. So ICED-a-thon is coming up. Last year we had in Goa. Can anyone give the link of Goa event last year? Many people attended. Yes, it is in Tri-City, means 3 cities we are covering: Chennai, Pondicherry, Mahabalipuram. So blindly you say to the dentist, try to attend this event. Lots of information is we are going to give. Lot of information. The life is changing. Totally the life-changing performance. Because when you, in 2 hours, you are trying to get 1 or 2 new things in your life. I hope I have given you that orientation. Think about those 5 days or 6 days. You are with the team of experts, cosmetologists, trichologists, and other experts. Definitely the dentist will be bestowed with all the skills, knowledge, where to practice, how to practice. Definitely there will be subject matter and a training will be given. But more than that, of the subjective matters, they will be totally getting life transformation. Because they come with all the, they throw all the negativity and coming to one place. So I am sure, I am 100% confident, anybody coming to this event, totally they will change their orientation. The next day they go, they change their total mindset and go. So for that movement, revolution, we need the right approach to be passed on to the dentists who are already struggling. Think about them. Think about the dentists who are all struggling. I have met one couple dentists. They could not have milk to feed their baby. Money should be needed. No, how much the milk? What is the cost of milk? Can anybody type in the chat box? 1 liter milk, how much it costs? Let us talk about livelihood. 60 rupees per day. So this is mandatory. Monthly it comes around 3,000-4,000. It's a basic necessity. So for that you have to do 5-6 scaling. If you are sticking to conventional dentistry, it's then what we'll do if like in COVID situation, there is some unconfirmed information. More than 50 dentists committed suicide. More than 50 in Western India itself. They could not pay the rent for the clinic. Itna margin nahi hai. As I told, the dentist clinic dependent ratio is negative. You cannot expect. Ye clinic kitna dega aapko? One clinic should be giving you the rent money also. Then you have to pay to the assistant. You have to pay to the you have to pay to yourself first. Where is the money? That much is not there. So you have to think about the corporates, how they have entered and spoiled. The corporates, no, people are ready to pay double to the corporates, and they also pay double salary and spoiled that street and clinics. So that is different chapter. Forget about the pains. Now talk about the gains. So how to make up the dentist to come to our event is the job of your work from home. You have to speak out the scenario with confidence. So whoever come here, I think Dr. Rani Priya, can you form a WhatsApp group and add these fellows here?
Okay, sir. I will do that.
Because the training is not 2-3 hours. In the WhatsApp, we will keep training you. How to do, how to, then right now, what is pending now? Everyone should telephonically talk to me. The next level training. So that you can discuss your problems, personal problems. Certain personal problems cannot be discussed here. For example, sir, how much I will be paid for this? How much should I say to my parents? I am going to earn, because there is no free work. I told, I don't like anybody coming and working free. I am working free. I don't need any salary. I am working free. That doesn't mean that I will expect everybody working free. So there is a, now we come to the personal zone. Now you concentrate on your work, your job. This is the job. How many of you thinking proud of joining the team? How many of you thinking here proud to be joining the team? Yes or no? No means by the same you would have left it. So Dr. Anipriya is there. She came to Goa event last year. Right now she is active in the team. So Dr. Anipriya, can you explain, last year you came to the event, this year you got some enlightenment? I'm not going to ask your monthly income, don't worry.
Yeah, I have a lot of improvements, sir. I have actually I got more contacts. So myself, I feel I'm like you are telling upskilling. I'm every day I'm getting a new experience and new one different exposure. So
So
apart
this
from
year also,
dentistry, yeah.
this year also, you make the team now. So make a WhatsApp group. You add all of the people here, just let them type in the chat box. Those who are all understood the training, this is a orientation. Your training is not yet completed. So training will be, I will make personal trainings. Everyone in the WhatsApp group, I will call. You don't worry. I will take your time. I will call and I will bring a best selling person inside from you. I am guaranteeing that. Whether you are selling or not, that's not in my hand. But I will make you a best seller because we have made a certain genuine understanding about the problem. Without understanding the problem, I cannot make you. The moment I say, you say, no, sir, no, selling and all, calling and all, I don't, it's not my cup of tea. Because many people having this prejudice, they don't know this is the main thing in life. Because once if you are passing till the conference date, Ranipriya, can you give that brochure and the conference details you have
Yeah,
handy?
yeah, yes, sir.
So till the conference, you will be best in the marketing. You will be a selling machine. I am telling you, guaranteeing you. After that, you go and open your clinic also. Then your emerging discipline also. See, without having this orientation, even if you get the cosmetology industry in your hand, how will you get the clients? Because you are going to touch the common people. Why I'm saying, why I'm again and again seeing the clients perspective, because we are all from dental background, patient perspective. It is very wrong. We cannot consider everyone as patients. Even they are having problems. We have to have. Yeah, the brochure is shared, so we can give you foolproof technique where to call, how to take up this matter, because no training session should not exceed 1 hour, because it's already 1 hour over. So we have to conclude. We can possibly meet if required again also. But the group, to form the group, just everyone give their number. I am giving my number. Everyone give the numbers so that the group will be formed, and in the group we will put all the materials. You can pick from there. You can pick. There are many groups with us. So this group is trained people. So Dr. Rani Priya, keep the heading as a
Okay.
trained people. Even
Okay.
if you are 10% trained, you call yourself trained. The moment you consider yourself trained, then your training done. No big issues here. Just you are going to speak out to your colleague, your juniors, and guide them. Whether they listen or not listen, their fate. And your fate is pakka. I will make everyone making 3.5 to 5 lakh if you are listening every step of ours, because people are making it. I can show you in the screen also if you want how they are making, because you So if everybody given number, we can wind up today's meeting because there is a technical problem in my hand. So we can finish with a good note. So everybody can type in the chat box, thank you. So we have to thank ourselves for attending this wonderful session. We will continue the ongoing training in the WhatsApp groups. Thanks for joining. Good night and goodbye.